Good afternoon, everyone. In case I'm not familiar to you, my name's Pete Koltis, and I am a managing director with Alvarez and Marsal's corporate performance improvement group here in South Florida. That's what I do by day, and by night, weekend, and all other times in between. I'm the chair of the President's Council at our FIU. So welcome to everyone that's here today. As we have done, I think Danya and Sandy and I were talking about the fact that this, I think, is our 15th or so roundtable virtual roundtable that we've done since the beginning of this the pandemic. And we started these roundtables with a discussion around COVID and preparedness for that the university had for it, and the testing center that was set up. And we're not that we're stopping these roundtables. I think we'll continue to do them, but we have a really interesting story to tell you about bringing something that's very unique and something you may not be familiar with that's happening at our FIU, and how it's helping at a local and national level around COVID from a completely different angle. So I think you're going to be very excited and interested in what you're going to learn today. And it's always a pleasure to gather with you. I am, of course, joined by my partner in crime, Sandy Gonzalez-Levy, who is here somewhere in the background. She's on our session with us today as well. And as you know, our FIU has continued moving forward and working hard throughout these past several months, despite the challenges of COVID, whether it's briefing the community or nationally with the help of Dr. Roldan and Dr. Marty and Dr. Trepka, or setting up the testing center, making sure that we had our commencement being done without a hitch. There's all sorts of aspects of how FIU's had to address and lead in the time of COVID. The university remains committed to student success and a place for innovation and solutions, and deal with pressing issues in our community. So today we're going to share with you one of our recent accomplishments, one that is truly helping to make a difference, during these times. So a team of FIU researchers from our International Forensic Research Institute, which I'll be honest, I did not know anything about that until very recently, have trained detector dogs that can accurately identify the COVID-19 virus. So imagine, almost like a metal detector, but a dog being able to identify COVID, the COVID virus. So I can't think of anything cooler than that. I mean, really, it's just amazing. When I heard about it, I'm like, can that really be? So I'm going to leave it to the experts. We've got a great panel of experts today that have all worked really well together, and I do want to bring them all together and kind of introduce them, and then get out of their way. So it's been getting a lot of media attention this week. The research has garnered over the last several weeks. So Meredith is going to show you a really interesting marketing video about that I think will kind of frame what we're going to learn about today, which was created by our team at External Relations, Strategic Communications and Marketing. So the team that's here today that you're used to dealing with had an active hand in putting that together. So, and as you can imagine, once this came out, we've gotten a ton of media attention nationally on this. So some of the biggest hits for this work have been on Fox News Network, ABC News Network, Weather Channel, New Yorker Magazine, just to name a few. And also has been picked up by Reuters and Getty, who have come to campus to do a photo shoot of the dog. So I think this is just all really an interesting thing that I think we'll all find it very fascinating. So I'm going to now, I think, turn it over and introduce our panelists. So as you can imagine, a man who needs no introduction, Dr. Ken Furton, our Provost and Chief Operating Officer. We also have Kevin Lothridge, Executive Director of FIU's Global Forensic and Justice Center. And then we've also got Dr. DeEtta Mills, Director of FIU's International Forensics Research Institute. And then leading the conversation with them and who will handle the questions and address them with the team is Meredith Formelli, Senior Media Producer at the National Forensic Science Technology Center. So again, if you knew nothing about FIU's work in forensics before, or even if you knew something about it, You're going to learn a ton today, and I think leave and as I am very proud at what's going on at our FIU. So please welcome me in joining the panel. Meredith, I'm going to turn it over to you.
Thank you so much. And as you mentioned, of course, we've been getting tons of headlines with this COVID-19 project, but the reality is this isn't the first time our detector dog team has been in the news, and our program goes back decades. So we put together a little video to give you an idea of what we're all about, and we look forward to discussing this on the back end. Take a look.
FIU researchers are using our knowledge of detector dog training to track down COVID-19. While these superstar sniffers are grabbing headlines now, FIU actually has a long history of solutions-based research experience and training of detector dogs. The first statewide canine trainer and detection team certification with independent scientific validation was started at FIU in 1998. As a joint project between the Global Forensic and Justice Center's International Forensic Research Institute and National Forensic Science Technology Center. Our first program worked to certify accelerant detector dogs, tasked with identifying evidence at arsons. Dogs can also be trained to detect currency, drugs, explosives, and human scent. They can also alert to mold and fungi. FIU's team received 2 paws up for research into dogs' abilities to detect the scent of laurel wilt, a fungus that killed more than 20% of the avocado trees in South Florida. And that brings us to today. 4 detector dogs, Cobra, 1 Beta, Mac, and Hubble, are working to detect COVID-19 on surfaces. If they get a hit, impacted areas can be quickly sanitized for your safety. But how do canines do it? Their sense of smell is up to 100,000 times the average human's sense of smell. Chemicals, microorganisms, and the body's response to infections all produce a scent. Our research team worked to isolate the odor of our body's reaction to a COVID-19 viral infection, allowing the dogs to learn it. Pups are quick studies. Dogs already trained in scent detection can add an odor to their arsenal in a matter of weeks. So if you see one of our working dogs on campus, know that these aren't your newbie noses. They're trained by olfactory experts at FIU.
So I know we're here to discuss the COVID-19 research. We're all excited about it, but we want to go back and give you that foundation and how we were able to get to where we are today. So guys, I want you to talk a little bit about how this all started back in 1998 and even before that really established our detection dog program.
So I'll start off and then I'll turn it over to the provost. In the late 1990s, we were working with some accelerant detection canines at the local forensic lab here in Pinellas County. And it was quite apparent there needed to be some scientific research put into how those dogs were using. We knew the dogs worked extremely well. We knew that the laboratories were taking evidence that were collected by these dogs, but they weren't always finding a flammable liquid. And one of the things that became very apparent is we needed a research university to partner with. So I've known the provost for quite some time. We reached out to Florida International University and we forged that partnership to put together this scientific-based certification of detector dogs, and that has moved into certification of other dog handlers of other types. Provost, do you want to add anything to that?
Yeah, happy to. Yeah, so we've been working, like I say, for many different types of dogs. I started doing work related to drugs on money, and a story that came out in the Miami Herald that you may not know, 9 out of 10 bills in your pocket have trace amounts of cocaine on them, and so we wanted to see whether dogs could actually detect the amount of cocaine that you're carrying around every day, and that's what really started off a lot of the collaboration, realizing that there were very few scientific studies around this topic, and so collaborated with NFSTC and IFRI to develop programs to not only look at the science, but also develop ways that we could make the dogs perform even better through certification and standardization.
And you all aren't just dog lovers, but you are. But what makes these animals so special, and why are they the go-to for this type of application?
Well, I can tell you that in the early days of the research, and the Provost and I have had numerous discussions about this, we were finding results that we had very sophisticated analytical equipment, and we were testing, and we were not finding any identifiable compounds, but the dogs still indicated. So it proved to us that the dogs are extremely sensitive. They run on their own, right? They don't require batteries. They require play or food as their reward. They don't want to do anything other than please people, so they work really well. They're much better than any machine, and that's one of the things that the Provost had spent a lot of time doing some research on, was looking at those analytical technologies and why were the dogs as good at or better than those technologies.
Dr. Mills, how did you get interested in studying this?
Oh, well, we actually live out in the agricultural area and have avocados. And we had a disease start to come through that was starting to kill the trees. And actually, we're with the provost one time when we were discussing this, and he said, well, I think the dogs could probably pick that up. And so we said, well, let's see. And we actually combined that with drones with spectral imaging, so they could fly over the groves and see if there's change in the chlorophyll content, and then we can send the dogs in to actually identify which trees were infected. So a little bit of personal background, because we had 8,000 trees we didn't want to die, but also just from the scientific standpoint, understanding the fungus and how it affected the tree, being able to work with the dogs and see how extraordinary they are, and working with Dr. Furton and doing the analytic chemistry. So we put basically these 3 different disciplines together and had a quite successful program.
So we're talking about training dogs to smell a fungus or a virus, but what does that really mean? What are they really receiving and processing?
And maybe I'll start with that, because that was sort of the basis of the initial work going back more than 25 years now. Because what we found was that dogs can't actually smell cocaine. So the fact that there's cocaine and money is immaterial. The question is, what are they detecting? We found out there was a volatile organic compound, they're called VOCs. And one of them, the key one for cocaine, is methylbenzoate. And we've found similar VOCs for other things like ecstasy and fentanyl and bath salts and so forth. And so then we can, once you know what the volatile chemical is, you can figure out how much is there, how much it takes for the dog to alert, and then we can actually develop training aids. And so that's another area that we're working in, is developing safe training aids for the canines based on the application. So actually, right during when the COVID-19 pandemic began, we started working on this project. And even though it's close to a year now before we were able to get a paper that has the scientific data, that's actually fairly quick. Most of these studies take years to complete, at least to do them on a very detailed, rigorous scientific basis.
And I think when I was getting involved with the accelerant detection canines, it was really a practical application. Running a laboratory that was doing fire debris analysis was really important that if a fire department or the state agency was using a canine and they were bringing you evidence, you had to go to court and testify. You either found something or you didn't. And sometimes that would put you at odds with the people handling the dog. So we wanted to find out the science behind that. And we also found out that people were saying, well, the dogs are indicating on just burnt material. Well, we would burn material, do the analytical analysis, and look at those VOCs that Dr. Furton was talking about, and found that the dogs were so well trained that it really wasn't the VOCs. It was probably a low level pattern for gasoline or petroleum product or diesel fuel that they were indicating on, that was masked by this massive background material. And those background materials give off VOCs that are very similar. The dogs differentiate between the background and the actual accelerants.
I think one of the challenges that we had when we were working with a biological, pathogen, was it's dynamic. It keeps growing. It's not like a chemical that you may have, like cocaine, it changes, but not very often. And so it was different stages of the disease, different things like that we had to consider as well. So it was quite challenging, same as the COVID, because it's a dynamic system as well.
So let's talk a little bit about how you're actually, first of all, how you're getting samples, what you're doing with those samples that makes them good training aids for the dogs that are safe and that are going to give them the best tools possible to go out and do their work.
Yeah, so what we actually, this project is a partnership with Baptist Health South Florida, and we worked with the team of there at Baptist to get face coverings from patients that were hospitalized at Baptist Hospital in the COVID ward that were positive for COVID, and those that were not positive for COVID. So therefore, there are volatile organic compounds and all kinds of normal breath samples and things that you might find, or these are patients who are both in the hospital for sicknesses, but the only difference is that one had COVID and one doesn't. And then we use ultraviolet C light, which is you shine the light on it and it kills the virus, but the odor is still there. So we took the masks to the laboratory, and we look at these volatile organic compounds that I mentioned. You look at the different peaks and how big the peaks are. You could tell what's there to confirm that the odor was still there, even though the virus was no longer active. And so then it was safe to be handled by the person working with the dog, the partner of the dog, and also safe to use as a training aid for the dog. And maybe Dr. Mills can then take it to the next level, what we did with those face coverings with the canine teams.
Well, I mean, we usually then will take that face covering and basically kind of cut it up in smaller pieces. We put it in a device that actually Dr. Furton patented here called a comp, which is a permeable polymer inside of a barrier pack. And then we start training them. First of all, we put it in the training wheel, which looks like a big stainless steel octopus, you might say. And we put the COVID positive masks in one of the containers, and then we put the the other masks in the other containers. And so we want to make sure that the dog's just alert to the COVID. Since the disease causes common symptoms, then even though we have different people and everybody has their own odor profile, the idea is that the disease itself has a commonality between people as far as the volatiles themselves that are coming off. And we wanted to work with the mask because it is a respiratory disease, and these are breath samples that we're looking at. And so we were able to take it from there and make the training aids.
Excuse me. So is that why? Because there have been other studies that use urine samples, but this is different. Is that because you really wanted to drill in to get those breath samples on the mask because it's a respiratory illness?
Well, that's one reason. We felt it was probably the most representative sample that we could get, and it's non-invasive. I mean, these are masks that people are wearing in the wards, and then they are collecting and putting in barrier packs for us. So there was no extra step that they had to do as far as collecting urine or even puncturing for blood or anything else. So it was very non-invasive. It was available, and we felt since it's a respiratory disease, it was the best sample to work with.
And it was safe for us to handle. Once we put it through the UVC, that's the key thing, is we want to make sure the dogs are safe and the researchers are safe. So that was a very good representative sample, but also it follows on other research that Dr. Furton has done in the past about human scent. And I think that that's something that makes this very unique, because we've talked about laurel wilt, which is a fungus on a plant. We've also done research on human scent, the persistence and the different profiles from humans. Now this combined the two of those, and maybe Dr. Furton can talk about some of that human scent work, because that leads us down the path of being able to track things.
Right. Yeah. So yeah, dogs are really remarkable. I mean, in fact, after 25 years, it's still some of the things they do, I find unbelievable. And so we were able to actually develop a technique where we could confirm that dogs can identify people, even identical twins, based on the odor they give off. So there's something called a primary odor compounds that a person gives off. And it's actually an FIU patented technology in terms of identifying people based on scent. But the dogs can do it, almost instinctually. And it's allowed. We even found that after post detonation. So when we did it like vehicle detonation, and the human scent remains, that dogs can follow somebody who was the bomber of a vehicle just based on the odor that's there. And when we get it back to the lab, there's not enough odor to detect. So the dog is below the threshold, below the detection limit of our instruments. But we've done double-blind scientific studies to confirm that the dogs can actually do this and can identify people based on scent. It's used, unfortunately, it's not used that much in the United States, but it's used around the world in other countries very successfully, and as a piece of forensic evidence is scent identification with canines. And we're trying to work to bring that more here to the United States as well, and make it more of a regular tool that would be available to forensic scientists.
Plus, I think we also looked at some of the other research you had done based on the dog's ability to detect the scent of, let's say, a seizure, right? You had done some seizure work. I think that's important because that goes to show that we're really building upon all the expertise we've got to get to this COVID-19 detection, Dr. Furton.
Yeah, exactly. We had done a collaboration with a company that trains seizure dogs, and they are dogs that are able to, at least it was purported that they were able to detect tens of minutes before a person would have a seizure, that they're going to have a seizure. So then that person could go and either take their medicine or get to a safe place. And we were able to confirm that the dogs can actually do that. And we've identified several compounds, biomarkers, but we're still working on trying to develop a sensor that could, do what the dogs do. We don't have it at this point. The same thing happened with the Laurel Wilt project that Dr. Mills led, in terms of when the tree starts to show that wilt, it's too late. The tree will die. But the dogs were able to detect the odor with enough time that you could either inoculate the tree with the fungicide, or you could remove the tree, much like you would do cancer, and then save the grove. So in many of these cases, even though we're all in this meeting here on the panel, we're all scientists, and we think we have great technologies. In the case of Kevin and myself, chemists, and in the case of Dr. Mills, a biologist, and developing tools using biology, we still cannot beat the canines at this point.
Well, and I think it's important in this case, when we're talking about COVID-19, also because we're looking at searching large areas, there's no instrument that can search an area like our four-legged friends. It just is not going to happen.
So let's talk a little, go ahead. I'm sorry, Dr. Mills.
You just go back to the Laurel Wilt study. We were able to show that the dogs could find a tree that was asymptomatic but infected up to 40 days before the actual symptoms, and the tree would start to die. So they're very sensitive on picking up those changes. And similar to what COVID is doing as far as a metabolic change in the person, those trees were also going through a metabolic change because they were trying to fight off this disease. So it's very similar.
So let's talk specifically now about how the dogs are being used on the FIU campus. You are not testing people, correct?
No, not yet. We're not. We're mainly, it's kind of analogous to a bomb dog going through and clearing an area, to make sure there isn't a bomb. We're going through and clearing the area to make sure there's no residual contamination.
And it allows us to also, if there is an area that needs to be cleaned, we can actually clean it. Or if there's air filters that need to be changed, we know to change those. So it's preventative, as well as allowing us to cover large areas that will be populated.
Yeah, and we're still doing, it's ongoing work. It's sort of a combination of deployment and research. So we've deployed these dogs at the Governor DeSantis's Emergency Operations Center, and up in other areas in Tallahassee. And we're able to show that the dogs would alert in certain areas multiple dogs to the same area. And then later it was confirmed that that was somebody who was positive for COVID-19 and was now in quarantine, and including the filter in the room, so we're looking at that. We know, that could be a tool now to do some deep cleaning in those areas, which currently didn't exist. So in deploying them here at the university, the plan is to focus on classrooms and things like the Graham Center, high traffic areas for the students, so that we can provide an extra layer of confidence that that we're using every tool. We're I believe the first university in the world utilizing these dogs on campus. You may have heard about University of Pennsylvania, who they've got a canine program, and they were able to show COVID-19 dogs detecting urine. Their group is actually focused on really using it for medical detection. So they've got dogs can detect ovarian cancer, things of that nature. And we work closely with them. We also work with Auburn University, which is the other university in the country that's doing dogs. They have things like they call vapor wake dogs at airports and things like that. But I would say, the big three in the country are really Auburn, Penn, and FIU doing this kind of work.
Can COVID-19, as far as we know, be detectable on surfaces by a dog? Is there a point, or do we know, where that scent can no longer be detected?
There's a recent study that came out in Environmental Science and Technology where they looked at just how long COVID could last on different surfaces. And depending on the surface and the porosity of the surface and everything else, it can be either 2 hours to actually 3 or 4 days. And so we're sure that there's COVID odor there, whether or not the virus is still infective, because it can only really survive outside of its cellular host probably for about 72 hours. But at this point, we're confident that dogs are picking up the odor. The challenge comes on how do you sample an area then to take it to the chemistry lab that Dr. Furton has and verify that. So, but it does last on surfaces, and they looked at high traffic areas, garbage cans, liquor store handles was the highest, going in and out. So I guess people are quarantining in different ways.
Well, the interesting thing, Meredith, is too that this points out why it's important to actually do what everybody told us to do, which is use soap and water and rub your hands together, because just cleaning the surface doesn't remove the odor. You need to physically remove it. So in some of these areas, these classrooms or areas that are being checked, it depends on what the surface area is. If it's cloth, it's one thing. If it's a hard surface that you can actually put a cleaner on it and scrub it off, then that's a different story. And that's additional research that needs to be done. Remember, we're early days. It may sound like a year's a long time, but for the research we're talking about, we're early days in this, and we're preparing for the dogs for the next pandemic or the next opportunity for them to be able to work in this area.
Have you gotten interest from other organizations or universities or law enforcement agencies that want you to be a part of training their dogs?
We've gotten quite a few emails and interest and phone calls and stuff. A lot of them are in, people were asking about churches. They were asking about summer camps, different places like that people that, dogs could go in and verify that it was clean. So there's been lots of different possibilities of being able to use in any setting.
Large high traffic areas would be where they're suitable, and the requests are coming globally. So it's not just people from the United States. Dr. Mills has fielded numerous emails, as well as Dr. Furton. So I think it's interesting that from the work that's being done at FIU, you're getting a global response.
And you said the research is still ongoing. You're still collecting data on the dog's performance. So talk to me a little bit about the training process, the length of time it takes to train a dog to a new scent. I know it can vary based on the dog and their skill level or their experience. Can you talk a little bit about that process?
Yeah, I mean, in general, it's interesting because you can one of the things that's, I think, unique about this project is we use something called this universal calibrant, which is a pure compound. One of them that we use is bromooctane, and other groups, including at University of Pennsylvania, have also been researching using this calibrant. And so you train the dog on the odor, you know that they can work an area, you know they have a particular threshold, you know they can work towards their positive reinforcement, and then you can switch them to any odor you want. So you can switch the dog to a new odor and they'll pick it up in actually in a matter of really hours. They start to smell the odor, but in 2 or 3 days they can start to alert to it. But it takes probably at least 2 or 3 weeks to get them up to proficiency. And a well-trained detector dog can be over 90% accurate, which is actually even higher than a lot of the PCR tests, but that takes additional training to get there. And if you're starting a dog brand new, it can take 2 or 3 months, because then you've got to go through the whole process, and to them it's just a game, and you have to keep working on playing the game and getting their reward. And so a well-trained, sort of a well-experienced dog, you can train up very quickly. But if you take a rescue from a shelter, it may take you, a few months to get them proficient.
And when you're selecting those dogs, you got to look at the ones that are very driven. They're either food or play reward. They want to do nothing but get the right answer because they get some play or they get some food. And when you do that, it's a very large commitment for the handler. Us as scientists have the easy job. The handler has the hard job because that's 24/7, and they love what they do. But the dogs can be a handful, because if they're really driven to do this, you better entertain them, because they are either really smart or really want to be with humans. And sometimes they train you, you don't train them. So it's quite interesting. I had a food reward accelerated detection canine. His name was Sherman, and he was part border collie and part black lab. And I cannot confirm or deny that he may have eaten a few window shades and things, but he was food reward. So he only got fed if he worked. So if I was on the road, my wife had to feed the dog. So it's a family commitment when you're talking about these trainers, and keeping them proficient is key. I think the UDC is probably one of the smartest patented ideals that FIU's had, because it's the baseline. When we were doing this 25 years ago, we would have loved to have a baseline, because if there were 5 trainers, you had 25 ways of doing something in the room, and they never had the same thing. Some people would believe that it was 50% weathered gasoline. Some said it was 75% weathered gasoline. We couldn't then say all the dogs were trained the same. Whereas our COVID-19 dogs all started out the same way and used the same scent. Isn't that correct, Dee and Ken?
Yes, yeah, I agree. And then, the joke is that the best detector dogs make the worst house pets. So, if you have a house pet that you're looking to farm out for research, we may be interested in working with them, and maybe if they're eating your items at home right now.
And it's not just keeping or training the dogs or anything else. For us, the bigger challenge was taking the dogs that were used to running off leash in a grove and putting them in an auditorium like you saw in the video, because now they have to learn how to work down in the chairs, and they have to work on leash in many cases and everything else. So that took a while for them to get used to a new environment. But the other thing that we do with our dogs is it's not just all about detection. They get to swim, they get to do agility, they get to just run and play with the other dogs and everything else. They get to be a dog, as well as our best tool that we have in our toolbox.
And I'm sorry, go ahead, Kevin.
I was just going to say, I think it's very interesting too that we're able to use rescue dogs, non-purebred dogs, for detector dogs. And if people think about this historically, they domesticated these animals. We see German Shepherds, Belgian Malinois, for the work that they were doing, which was more of a law enforcement military work. For these detector dogs, it's actually better if they're small and can get in small places and jump up on things. So we're very fortunate to be able to use a wide variety of dogs if they work. Now, not everybody makes it, right? So you have to do this training program. You have to do a selection program before you get the right set of dogs to do the work you're looking at.
And actually, Carlos had just asked that question about our particular breeds of dogs found to be better. And I wonder, I mean, it sounds like every dog has the possibility, right? But are some dogs better suited for some applications?
Yeah, so it actually comes down to, if you look at the dog's nose itself, they have up to 50 times more olfactory cells than humans. So they are more sensitive and they have a much more efficient sampling apparatus. If you look at the nose and the nares of the odor actually comes into the front and out to the side, almost like a pumping action, where ours just go up and down. And so a smaller breed has less olfactory cells than a larger breed, but in general, it's really more variation within a breed than between breeds. And so it's really the choice of the type of application. So if you're looking for, say, an explosive detection canine that's going to be single purpose, and you just want to be around crowds, like an airport, you see a lot of labs because Labradors are one of the most popular dogs. If you want to cross train a dog to be a patrol dog, to be able to potentially go find a suspect and search on scent, those tend to be things like Shepherds or Belgian Malinois that are a little bit more athletic, but they're kind of more scary to other people, so you wouldn't necessarily put them in big crowds. We did work with like mold detector dogs that they use in homes. Those are typically rescues, small dogs, again, because you don't want to, you want to be able to put them in tight places, and frankly, the bigger the dog, the more they eat. So you got extra costs associated with the larger breed. And then it's also intelligence. So like one of the smartest dog breeds is a poodle, but in some cases they're almost a little too smart. And so you'd want to find dogs that are bright and intelligent, but really want to please you. And so there's a personality piece as well as a physical attribute. And of course, many cops probably don't want to be walking their poodle into, crime scenes.
I don't know. I think that would be kind of fun.
Well, actually, I think if anybody's been through Miami International Airport, you've seen one of our favorite dogs, which is the Beagle Brigade. So, right, you have hounds that sniff out food and other products that aren't supposed to be there. Everybody loves the Beagles, and one of the reasons they use them is people come up to them with their bags. So the dog doesn't have to search too hard. The Beagle just sits and they open the bag and there's the contraband that they've brought through Miami International Airport. But the Beagle Brigade has been one of the best developed groups for finding those illegal food products, and they just go without anybody even notice, other than this little dog comes up to you and sits by your bag.
Right, and Beagles, that's an example too. They love to eat, right? So they only get fed when they find the odor, and so that's how they work. But you have other dogs like pugs. I used to have a pug. They love to eat, but they're really not that bright. So it might take you years to train a pug to do what the Beagles can do.
Plus, with their smooshed in faces like Frenchies, they don't sniff very well.
Well, and every dog, they basically are surveying their entire environment all the time, more through olfaction than they are through sight or hearing, even though those are also very, very astute, qualities in them. But they are always taking in air and scent and basically kind of saying what's going on around me through olfaction rather than anything else. So they're very good at it.
And two of the dogs for the COVID project are rescue dogs. Yes. So do you want to tell us a little bit about Mac and Hubble?
Okay. So Mac is a rescue. He actually, he's the little terrier that you saw, the little dark terrier. He actually was in and out of the animal shelter several different times because he was so high energy. And then our trainer found him, and with her skills, and she used to actually work the Beagle Brigade dogs as well, but with her skills, she was able to actually make 2 movies with him. He's a movie star. And then she does commercials and different things like that with him. So he's getting older now, so he's not quite as rambunctious, but he's small and he can get underneath the desks and everything. So he really makes a difference on the team. Hubble is probably the newest dog. Again, a Border Collie cross, and Border Collies, if anybody is familiar with them, are extremely smart and wanting to please and everything. And he's picked up detection very, very quickly. He's very, very pragmatic about how he goes about searching and everything else. And of course, they're always wanting to please. And so they get their toy and they get to play. So and that gives us 3 different size dogs, the 2 bigger Belgian Malinois and the Dutch Shepherd. And then we have Hubble, and then we have Mac, who can get in there underneath the desk. The bigger dogs can actually get their feet up on a high counter or something, and also scent there. So it makes nice to have all these different sizes of dogs, and they're all so willing. It's amazing to me that our four-legged best friends are such a good willing to help us.
And they do, they're rewarded with a toy. So we've been talking a lot about treats, but their treat is to play with their favorite toy, right?
Well, yeah, except for the fact that they've figured it out. If you hold on to your toy real hard and won't give it back to the trainer, she'll give you a treat, and then you drop your toy, and then you can start the whole process again. So they actually get a toy, which is the Kong. Once they drop that, usually they'll get a little treat. So, they've played us pretty good.
And they're smart. They figure it out, right? If you train them one way with like Dee said, or you train them the other way where it's totally food reward, they're totally driven. So they realize that if they just set it every can and they don't get a treat, that's not benefiting them. So they really concentrate on where the odor is coming from. And remember, these dogs air scent. So we've talked about this a lot. They're not putting their nose on something to scent it. They're sniffing the air to follow the trail to where the odor they're rewarded for is, or what they're trained to find.
And that's the question that some people have is, can dogs get COVID? Can dogs give COVID to humans? Can humans give COVID to dogs? A lot of people get concerned about that, but there's really nothing to indicate that that's a concern, right?
There's been a couple dogs that were associated with COVID deaths of the dog. They were both very old and had underlying conditions, and they were in the house with the person, sleeping in the bed with them, and everything else. So it's not that they can't get it. It's very rare. And we've checked with several different veterinarians, and they said that, yes, the dog could get COVID, but it's so mild half the time you don't even know that they have it. But there have never been any incidents of the dog giving COVID to a person. So we know this disease came from animals. So we know there's the possibility of transmission from animal to human, but they haven't had any evidence of the dogs being able to give it to their owner.
Well, and I think if we look at this, the people we've spoken to, it's more likely that a feline would pass it from one to another, and that this is a novel coronavirus. There are several other novel coronaviruses that pass out there in nature. So, looking at those things, you'd have to have a larger instance of dogs passing or from COVID, or humans catching it from a dog to
right.
Look at.
And we've demonstrated that these dogs can work with face coverings just like we do. So if you're in a situation where you think there may be a risk of the dog encountering the COVID-19, they can wear face covering, and the handlers wear face covering to prevent possible transfer to each other, or from a scene where you might see maybe a significant amount, like a hospital setting, something like that.
And to point out, this is no different than a drug detection dog and fentanyl. Fentanyl affects dogs as well, and they have to Narcan them. They have used barrier covers on those detector dogs as well, just to try to keep out that material.
And we also teach the dogs to alert at a distance, so they're not putting their nose right up on, say, a contaminated spot on a desk or something like that. They'll actually come in and say, it's here, rather than it's right here. And so we know then that we have to go in and clean that area. So they can alert at a distance. Once they come into the source, they don't necessarily have to put their nose right on the source. They can tell us at a distance.
And I think that's one of the most important things when we're talking about having the dogs on campus and being the only university to do that. That allows a large area to be searched, to be cleaned, and then done again over and over, just to make sure that we're using the best tools that we have to ensure the repopulation is safe as possible.
So what's next? What can students and the community look forward to in the coming weeks and months? Are we going to see the dogs around more, or are we going to see research coming out? I know nothing is set in stone, but what do you expect folks will be able to see in the near future?
Yeah, so I'll start with, in the coming weeks, you'll be able to see these COVID dogs on FIU's campus, especially in areas you may not see them like in the mornings or in the evenings when they're searching classrooms, but later on you'll see them on, in the Graham Center and places like that, and as an extra layer of trying to build the confidence for, we want more students as well as faculty and staff to feel that we're using every single measure that we can to provide as safe an environment as possible. And the COVID-19 dogs are part of that. Of course, there will be pantherized, Sandy will have for FIU. And then also deployment in other areas. So we're looking to deploy them not only for services, but possibly also screening individuals or the air around individuals at like the South Beach Wine and Food Festival. And I think you'll see this increasingly being used at other events, any large, sporting venues, theme parks, things of that nature. The challenge there is, we will be continuing to do the research and then developing standard protocols in order to train additional dogs, because that's always the challenge, is to increase the number of dogs that are available. And then we'll also be looking at other things such as variants. We know that there are these variants that people are concerned with, and they're spread. And so we haven't done that research yet, but we can get samples of the different variants and see if the dogs can differentiate them, and see if that might be also a tool to see what the spread of variants are quickly. I don't know if you want to add to that, Dee, and then Kevin.
Well, I mean, we don't know yet if there's a difference in the metabolic response in the odor that's produced through these different variants. So that's something that we'll have to make sure that we're aware of when we're continuing to research that. And if they can, wouldn't surprise me at all, if you've been around detector dogs, that they could be able to pick up the difference. But that's ongoing research that we'll have to think about.
Well, I think one of the key things for everybody to realize is we have 4 detector dogs, and there's not a lot more that you can do with the 4 detector dogs than we're already doing, right? So we would like to try to build a program that's got dogs for research, then the tools to train other people's dogs, right? I think that we've told a story that we've been doing this for quite some time, and there are some patented technologies that can be licensed from FIU for this. But the real future is going to be for FIU to have a program where these dogs are trained, and we're changing what they're imprinted on as the need arises, because we said it took a year. It took us that long to get the arrangements in place, to get the training aids, to get the dogs imprinted. It only took a few weeks to get the dogs imprinted. So there's a lot that we can do in advance for future activities, for future pandemics, for future items that we want to identify, but we can only do so much with the 4 dogs that we currently have as a partnership with another organization.
And I think that sort of answers a question that just came in from Sergio, but you may want to expand on this. We've talked a little bit about this. He was asking if there's a plan to create a program to train other dogs in the community to help folks out there who are high risk for COVID effects. So just similarly to how dogs are trained for allergies, bombs, and many other things. And I think what you're saying is the possibility exists. Just the partnership is where we need to be.
Yeah, I would say definitely. And, we're open to looking at any of those possibilities, but I think I yet dogs, like to say, can always amaze me, even as a scientist, that sometimes it seems unbelievable what they can do, but I do believe the skills that they could provide are still untapped. It's just, really the tip of the iceberg in terms of what they could be used for.
And we have a lot of students that are interested in pursuing this as their academic career as well. And I think that that's something that we should look forward to, because we have several alumni that have graduated from FIU who are working in this field in Washington, D.C. for federal agencies.
Well, and I think internships would be something that we could definitely support. We also, I know in the kennel that we're familiar with, have a couple dogs coming up into training, but they won't be ready for a little while, but so we are looking at trying to expand what we can do with the dogs that we have, but there's no reason that we can't support some internships to learn this, and then partnerships with other organizations, and just thinking about things expanding on the work that Dr. Furton's done on seizure dogs. We've already had some interest in partnering with a service dog provider that would like to be able to know, not only have the dogs they would do the training, they want to know what the dogs are alerting to. So it goes back to putting that science behind the odor, which makes our program so strong.
And I think we have a lot of requests also for things like counter wildlife trafficking, where people are trafficking in different types of animals and animal parts, where we could play a significant role as long as we had the program in place, because we can do the science behind that.
Well, I hope folks learned a lot. I think that you know, the COVID-19 research is what grabs the headlines, but when you dig a little deeper to see how much work has gone into this over the years, and the commitment of all three of you to continue to focus on the science, on the standards, and developing a practice that that a lot of folks can replicate if they follow your methods and procedures. So I think it's wonderful, and I'm sure folks can reach out to you if they have more questions. For now, I'm going to turn it back over to Pete to wrap things up for us.
Great, thanks, Meredith. So I told you, right? I told you this was going to be great, and it was. And Meredith, you did a phenomenal job. Thank you. And certainly Dr. Furton, Dr. Mills, and Kevin Lothridge, really appreciate you sharing with us not only the history of this. I didn't realize the depth of that history that we've been working with these dogs, and all the different applications of it. And another one, right, that we find out that FIU is one of the top 3 universities in the country in this area. So it really is preeminent. Want to thank you. Also want to let everybody know that today's webinar is being recorded. So if you want to share this, and certainly my President's Council brand ambassadors out there, this is a great story to share. What we learned today is a great way to share. So I think it's being recorded and it'll be available. We have a LinkedIn page for President's Council and YouTube page, so you can pull this off of that. We also sent you a link just directly to the forensics website, so you can see a lot more about what they're doing with the dogs. And get access to some more information. I would also ask that you please fill out, take a few minutes to fill out the survey that you'll get to help us plan for future roundtables. We want to make sure that these are relevant for you and informative. So I want to thank you all again. Sandy, you want to say anything? You want to say just a quick hello and thank you? There she is.
Just a thank you to all the participants and also the panelists. Thank you so much. Again, this is great information for the whole community. So thank you for participating.
Pleasure.
Great. Sandy's going to work on some FIU dog gear. She's going to sew some stuff together.
Yes, please. Yes.
Well, they do.
Gotta factorize them.
They do have blue and gold harnesses that they work in with their name, and it says FIU Canine on it.
We'll work on that. Absolutely.
What we should work on is like some COVID sniffing meme type T-shirts that we could sell, Sandy. That's an idea.
Yeah.
So.
With a dog print on it.
Exactly. So, all right, great. Thanks, everyone. Be safe, and we'll see you next month.
Yeah, well, thank you very much.
Thanks, everybody.
Thank you.
Bye.
Bye-bye.